Assalamu alaikum. I am discussing about peripheral arterial disease. Peripheral arterial disease mainly occur due to atherosclerosis, which is related to plaque rupture. Another important cause of peripheral arterial disease is diabetes mellitus, which is associated with atheroma. Both lower limbs, that is legs, are almost 8 times more occurring site of involvement than the upper limb. Clinical features of peripheral arterial disease, which includes intermittent claudication, severe limb ischemia, acute limb ischemia, atheroembolism, and last is subclavian steel. Intermittent claudication usually occur in the both cup muscle is most commonly involved, and patient complain of pain in the both calf muscle. They may also feel pain in the both thigh and buttock, and this pain mostly occur due to walking, and which is improved by taking rest, and this pain is cyclical pattern of exacerbation and resolution due to progression of disease and the subsequent development of collateral circulation. Severe limb ischemia, which comprises of subcritical limb ischemia and acute limb ischemia. Subcritical limb ischemia is associated with ankle pressure less than 50 subcritical limb ischemia occur due to subcritical limb ischemia, which is associated with ankle systolic pressure more than 50 millimeter mercury, and critical limb ischemia is associated with ankle systolic pressure less than 50 millimeter mercury. Acute limb ischemia is another presentation of peripheral arterial disease. Acute limb ischemia in the two form. One is embolism, another one is thrombosis. Now, what are the difference between embolism and thrombosis? Thrombosis is associated with collateral circulation occasionally, but embolism is not associated with collateral circulation. Embolism is associated with second to minutes in onset, but thrombosis is associated with hours to days in onset, and limb involvement is 3:1 in embolism, that is lower limb is involved more 3 times than the upper limb, but in case of thrombosis lower limb is involved 10 times more than the upper limb. In case of embolism, there may be a source which is obtained from its definition of embolism, and previous claudication may occur in thrombosis, and palpation of artery is usually soft and tender in embolism but hard and calcified in thrombosis. There may be bruise in thrombosis which is not present in embolism. Diagnosis is usually clinical in case of embolism, but angiography is needed, arteriography is needed in case of thrombosis, or venography is needed in thrombosis. Treatment is embolectomy and warfarin, but thrombosis, in case of thrombosis, the mainstream of treatment is thrombolysis and bypass surgery. And loss of limb is more common in thrombosis than the loss of life, but in case of embolism, loss of life is more common than loss of limb. There are some factors which are involved in peripheral arterial disease, which includes anatomical site, collateral circulation, speed of onset, and mechanism of injury. Anatomical site, which comprises of cerebral circulation, renal circulation, mesenteric circulation, and limb circulation. Collateral circulation may be occurred in thrombosis, and speed of onset which may occur more common or more rapidly in embolism than the thrombosis, and hemodynamic status, thrombotic status, atheroembolic status, or thromboembolic status, there may be related, these factors are related in peripheral arterial disease. Now I want to discuss about the symptom and sign of acute limb ischemia. Acute limb ischemia is associated with pain, pallor, pulselessness, perishing cold, paresthesia, and paralysis. Subclavian steel is associated with dizziness and collapse and cortical blindness, which occur due to diversion of cerebral circulation through the vertebral artery towards the limbs, that is upper limbs. Now investigation in case of ankle brachial pressure index AB, ankle brachial pressure index ABPI, which is very important in case of limb ischemia, that is peripheral arterial disease. ABPI is normally 1, but in case of intermittent claudication, it may be ranges from 0.5 to 0.9, but critical limb ischemia, this ABPI is less than 0.5. Management of peripheral arterial disease comprises of cessation of smoking, avoidance of alcoholism, regular exercise, antiplatelet drug, reduction of cholesterol by use of statin, and dietary modification and weight reduction, and treatment of coexisting disease such as diabetes mellitus, hypertension, anemia, heart failure are very important in case of management of peripheral arterial disease. The peripheral vasodilator such as cilostazol has been shown to improve walking distance and should be considered in patients who do not respond adequately by best medical therapy. So this is all, and lastly surgical intervention may be required, which is angioplasty and atherectomy, bypass surgery may be required, and occasionally stenting may be done in case of peripheral arterial disease. So thank you all. Assalamu alaikum.